Ms. Support, Understanding Transverse Myelitis Explained. Transverse myelitis is an inflammatory condition that affects the spinal cord. It causes damage to the protective covering of nerve fibers, known as myelin. This inflammation disrupts communication between the nerves in the spinal cord and the rest of the body. As a result, individuals may experience symptoms like back pain, weakness, sensory changes, paralysis, or loss of bowel and bladder control. Transverse myelitis often affects both sides of a cross-section of the spinal cord but can sometimes impact only one side, which is referred to as partial myelitis. When we look at transverse myelitis in the context of multiple sclerosis, or MIS, it becomes particularly significant. Transverse myelitis can occur as a one-time event or as an early symptom of MIS or other autoimmune diseases that affect the nervous system. MIS is a chronic autoimmune disease where the immune system mistakenly attacks myelin in the brain, optic nerves, and spinal cord. This leads to a wide range of neurological symptoms. In contrast, transverse myelitis specifically involves inflammation that is limited to the spinal cord. It is important to note that transverse myelitis can be a one-time illness or the first sign of a broader autoimmune condition like MIS. People diagnosed with transverse myelitis, especially those with partial myelitis, are often evaluated for MIS due to the overlap in symptoms and the involvement of the immune system. While MIS affects multiple areas of the central nervous system, including the brain and spinal cord, transverse myelitis is confined to the spinal cord. This distinction is crucial for diagnosis and treatment planning. The causes of transverse myelitis can vary. Many cases are idiopathic, meaning no clear cause is identified. However, it is believed that an abnormal immune response leads to inflammation and damage. Transverse myelitis can also be triggered by infections, immune disorders, or other inflammatory diseases. Symptoms of transverse myelitis can develop rapidly. They may include weakness, numbness, pain, and autonomic dysfunction, which can affect bladder or bowel control. The severity of symptoms and recovery can vary widely among individuals. Treatment for transverse myelitis typically involves anti-inflammatory medications like corticosteroids to reduce inflammation in the spinal cord. Early treatment can improve outcomes, but some patients may experience lasting neurological deficits. Most individuals with transverse myelitis experience a single episode and may achieve partial or full recovery. However, recurrent transverse myelitis or additional neurological symptoms may indicate an underlying condition like multiple sclerosis or neuromyelitis optica spectrum disorder, which requires further evaluation and long-term management. In summary, transverse myelitis is an inflammatory condition of the spinal cord that can occur independently or as part of multiple sclerosis. Understanding transverse myelitis is important for those with MIS, as it may representing an early manifestation or a related immune process affecting the nervous system. Prompt diagnosis and treatment are essential for managing symptoms and improving recovery. Ongoing monitoring is also important to distinguish isolated transverse myelitis from multiple sclerosis or other autoimmune diseases. Always consult healthcare professionals for personalized medical advice and treatment options.